Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's learn the 90,000 series, Medicine. Let's have a look into the few guidelines of medicine. So let's look into few guidelines. First thing, always check for two things in mind. What is the step or product used? Means which medicine is used. Then the route of administration, whether it is intramuscular, intravenous or subcutaneous. Now, for subcutaneous infusion, each 100 gram we should code 90284. And if the infusion exceeds 100 gram, like for example, if it reaches additional 100 gram, like 200 gram, then we need to code this twice, 90284 twice. Now, immunization for child up to 18 years of age via any route of admin. It can be intramuscular, intravenous, subcutaneous, intraoral, any route of admin. You need to code 90460 for the first vaccine, and for the additional vaccine, if it is a combination vaccine, for the additional component, you need to use the code 90461. Now, immunization percutaneous, intradermal, subcutaneous or intramuscular for other ages, we need to use the code 90471 and 90472. Now, immunization intranasal or oral, we should use the code 90473 and 90474. And we should not report 90471 and 90473 together. Let's look into few psychotherapy guidelines. There are three types of psychotherapy: individual, family and group psychotherapy. For coding individual psychotherapy, individual and family, okay, time is important. If the time is less than 16 minutes, we will not use any code. And for family, if the time is less than 26 minutes, we will not code. There is one more criteria: psychotherapy for crisis. If the time is less than 30 minutes, we will not code. Okay. And for the group psychotherapy, there is no specific time. We can code it directly. Moving on to dialysis. Two types: hemodialysis and peritoneal dialysis. For hemodialysis, we will use these are the codes to be used: 90935 if single evaluation is done by the physician, and for repeated evaluation 90937. For determination of blood flow in graft, we will use the code 90940. Now, peritoneal dialysis, for single evaluation, we will use the code 90945, and for repeated evaluation 90947. Now, what is ESRD? End-stage renal disease. In end-stage renal disease, while coding, we have to look into three important points: age, number of visits, and the month. Month in the sense it can be a full month, per month or per day. Like how is the number of visits, like that. So under full month and per day, there is no number of visits, but for per month, the number of visits is important. It means we need to check for the number of visits if the question is related to per month. Now, there are few ophthalmology procedures also in 90,000 series. There are two ophthalmological services. One is intermediate service and another one is comprehensive service. Intermediate service means evaluation of new or existing condition. And comprehensive services means general evaluation of complete visual system. And these are the few codes that are commonly used in ophthalmology. Code for refraction, refractive state, 92015 means visual examination. Okay, sight testing, that is 92015. Code for gonioscopy 92020. Code for serial tonometry 92100. Ophthalmoscopy procedures 92201 and 92202. These are the two new codes. Now, fundus photography 92250. Now, moving on to echocardiography. Two types of approach: transthoracic and transesophageal. So, you need to check what approach it is. The ECG is being done. And these are some examples of codes for transthoracic 93303. transesophageal, example 93312. Now, pulmonary ventilator management. There are three types of ventilator. Hospital-based ventilator. These are the two codes 94002 and 94003. Nursing-based ventilator 94004 and home ventilator 94005. Now, special EEG tests. If the time is less than or equal to 12 hours, we need to use modifier 52 along with the CPT code. And if the time is greater than 12 hours, we should not use the modifier 52. What is modifier 52? Discontinuation of radiology procedure. Now, moving on to the important part, hydration and infusion. There are few guidelines to code hydration. Okay. If the time is less than 30 minutes, we will not code. Don't use any code. If the time is 31 minutes to 1 hour, we need to use the first code, initial code 96360. And for each additional hour, use code 96361. When you bill IV hydration along with IV pushes, IV means intravenous, okay? And I have just put the short form. So when you bill an intravenous hydration along with intravenous pushes like injection IV pushes, always use IV push as the initial code. Code for IV push is 96374. There are additional add-on codes also for IV push, but this is the initial code, okay? And following that, we need to use 96361 for the hydration. Now, CPT 96360 is used when hydration is the only service performed. If only hydration is performed, like IV fluid is performed, then we will use the code 96360 according to the time, if the time is greater than 30 minutes. And like 30 minutes to 1 hour. And greater than 1 hour, use 96361. But in case if the IV push is also done, then you need to initially use the code IV push followed by 9636. Okay. Now, what is the code for intramuscular? IM means intramuscular or subcutaneous. Code for intramuscular or subcutaneous is 96372. And code for intraarterial is 96373. Now, IV infusion therapy, prophylaxis or diagnostic. What are the codes for IV infusion therapy, prophylaxis or diagnostic? These are the codes 96365, 96366, 96367 and 96368. These are the codes for IV infusion therapy, prophylaxis or diagnostic. So whatever is mentioned in the question, you need to be careful. According to that, you need to code it separate. Okay. So friends, these are few important guidelines from the medicine part 90,000 series. And practice questions we will be conducting in the upcoming session. So stay tuned for more videos. If you have any queries, you can always mark it in the comments. So if you're new to the channel, please support me and please subscribe to my channel. Thank you so much. Bye.